Sprains, a condition in which ligaments are stretched or torn by the powerful wrenching of a joint. Ligaments travel from bone to bone, aiding in stabilization and reinforcement for our joints, enabling them to be stronger and more efficient for us. Ligaments are made of dense, regular connective tissue, where bundles of collagen fibers are lined parallel to one another. This is wonderful for providing strength, but allows little amount of stretch for the ligaments. In fact, they usually tear before they do stretch. Damage to the muscles and tendons surrounding the joint and into the periosteum of the bones involved also occurs, creating very acute pain and more dysfunction. A sprain may occur at almost any synovial joint, though the most common place is the ankle. The severity of the injury depends on the percentage of fibers affected. A third-degree sprain is the worst, a complete rupture where the structure is torn all the way through. Sprains are very common, and a therapist must be aware of what to do when one comes into their clinic. With the ripping of collagen fibers, inflammation occurs immediately. This is a local contraindication, therefore massage therapists need to be aware of the four cardinal signs of inflammation: edema, pain, heat, and erythema. If the sprain is in its acute stage and inflammation is present, use strokes like effleurage and petrissage above the area to assist in drainage of tissue fluids. Remember, inflammation is necessary in the acute stage for tissue repair, so we don't want to eliminate it, we want to control it. Another sign that occurs in the acute stage of the sprain that is locally contraindicated is bruising. Here, blood vessels close to the skin have broken, and a small amount of blood has pooled close to the surface. Avoid this area in order to prevent further damage. Loss of function also occurs with sprains. As a therapist, performing passive range of motion on the client, staying within the pain limit, will aid in keeping as much motion within the joint as possible. In this acute stage, the main treatment protocol is the acronym RICE: rest, ice, compression, elevation. During compression, make sure the blood can still flow, and during elevation, be mindful of that the spot of injury is above the heart. Muscle spindles, proprioceptors that monitor the amount of stretch in the muscle, get dormant very fast, and the muscles will never properly repair if this happens. To prevent this, the client must perform muscle setting, quickly tapping down to get the spindles to fire around an injured joint. Be aware that an acute sprain may conceal the signs and symptoms of a bone fracture, such is often the case with Pott's fracture involving the lateral and medial malleoli. It's a good idea to get an X-ray before beginning treatment. A therapist will know if the client has gone into the subacute stage of injury, if inflammation has decreased. Simply ask the client and they'll tell you. The sprain will still be quite tender, so light effleurage promotes circulation, and light frictions where advances are beginning to occur are recommended. Active range of motion is also beneficial in this stage, as we want the client to start using their muscles again and increasing their range of motion. In the chronic stage of tissue repair, the joint begins to regain its function. However, the injury will still be achy and sore at the end of the day. Rebuilding of toned fibers has begun. Collagen fibers are spat out by the fibroblasts any which way, not often in the direction of the ligament. This can cause problems if left untreated, such as adhesions and stiffness within and around the joint. This may lead to further problems, such as contractures and chronic weakness of the given joint. As massage therapists, we can help reorient these fibers of scar tissue to run parallel with the healthy structures. Here, passive and active ranges of motion are important to keep structures fluid and moving. Stretching and weight-bearing activities will aid in proper alignment of the fibers, and strokes such as deep friction and local cross-fibering are great at breaking down those cross bridges of collagen. Following this treatment plan, the client should be back to full strength and full range of motion within a few weeks. Although sprains are very common and they are easily preventable with proper footwear and warm-up before